It is my conviction that we will only get health care reform worthy of the American people when the American people demand it. It is foolish to think because a presidential candidate wants something, it will happen. There is no question that that person is important, but the majority of Congress must be convinced, and so convinced that they become almost bulletproof to special interest groups. The United States today needs to use the experience and expertise of lots of groups to design a health access program for all, one that is worthy of our people and compatible with our cultural values. It is a doable task, but until a sufficient and diverse number of people and groups demand this, we will not have the national will to deal effectively with this problem. There needs to be a process that looks for solutions, explores options, and shares data in ways that acknowledge that there will be trade-offs and some risks, but we are going to pursue a rational and beneficial health policy for our nation. Everyone needs to be at the table, and when they are, I believe we can reach agreement on how to move forward. The Catholic Health Association has worked for well over a year with its members and many other groups who share our concerns that our healthcare delivery system does not serve our nation well. We determined that the most helpful thing we could do would be to participate in the discussion in an open and transparent way with a clear set of core values that we thought exemplified the best in our country as well as our culture. These core values are human dignity, the common good, concern for the poor and the vulnerable, stewardship, justice, and pluralism. We believe that these reflect not only the best of our nation, but the culture of our nation. The Catholic Health Ministry looks forward to a healthcare system that truly promotes the nation's well-being and respects the dignity of every person. Building on these core values, we designed a set of principles through which we would evaluate every suggestion for the reform of our health delivery system and the financing system for that. We do not believe that the Catholic Health Association has all the answers. We do not believe that we should design the nation's healthcare system in isolation. Rather, we want to be at the table discussing various proposals, whether it is Senator Ron Wyden's Healthy Americans Act or any of the other proposals being put out by the presidential candidates or other organizations. We want to be very clear about our principles, and we have derived these after more than a year of consultation with leadership and health care delivery and administrative personnel at every level throughout our ministry. These principles are, first, healthcare must be available and accessible to everyone, with special attention to the poor and the vulnerable. It must be health and prevention oriented and needs to be sufficiently and fairly financed. We further believe that it must be transparent and consensus driven in the allocation of resources and organized for cost-effective care and administration. We believe that it must be patient-centered and designed to address the health needs of all stages of life, from conception to natural death. And finally, designed to deliver the greatest possible quality. We didn't come to these principles after getting a bunch of researchers or think tank people together. These principles represent the input of people in the admitting office, of radiology techs, of emergency room doctors, emergency room nurses. They represent the input of people in clinics who can give basic health care but can never get subspecialty care for the poor and the uninsured. They represent people whose families are locked into insurance programs. And we were very deliberate in finding ways, whether you were someone who was older and had spent a long time in healthcare and had a lot of wisdom to give, or you were a young person trying to make career choices and having to do that with a trade-off of health plans being offered by potential employers. We also tried to do it using the media. So whether you like to blog or whether you like to write letters to the editor, we tried to find a forum for you to give us input. We believe that these principles are simple and straightforward, and that they would serve our nation well if our health delivery system reflected them. We have spent a great deal of time in communities throughout this country helping people to sort out misconceptions, to focus on solutions, and to believe that more equitable and compassionate healthcare delivery is possible in this great nation. In the meantime, Catholic healthcare is an integral part of the safety net of this country. In 2006, we measured, in response to the Senate Finance Committee, what Catholic healthcare was contributing to this nation using standard methodologies and data sets. We were able to document that in 2006 alone, Catholic hospitals provided more than $5.7 billion in free care and services that benefit communities in this nation. Most of that was targeted at the poor and the vulnerable among us. We are an association that often rejoices when we establish another clinic or we find a new way to provide a special service to the poor. But the reality is we should not be rejoicing at these developments because they are further confirmation that we as a nation have failed to address the basic rights of all our people. A basic right that, when not properly protected, creates untold suffering and in some cases death, not only for those who don't have the insurance, but for our nation as a whole. We are as smart and as compassionate as any other country in this world, and I am convinced that we can and we will resolve this very complex and challenging problem, and I hope all of you will help me send that message. Thank you very much.
And now we'd like to return to our speaker for our traditional City Club question and answer period. We welcome questions from everybody, including guests, and holding the